Hey guys, welcome to my channel, or welcome back. My name is Amber and I produce beauty related content, and today I'm going to be starting a two-part video series talking about the pre and post facial procedure tips that I have learned over time, as well as things that I have learned from industry experts and things I've researched online. So a bit of a disclaimer, I am not an expert in this area. However, I am a medical professional, I am a nurse, and so that tends to be the lens at which I look through this with in terms of things that can prepare someone for a procedure as well as the aftercare. So if you are interested in hearing more about my pre-procedure tips, which we will talk about in today's video, stay tuned. So with regards to my own experience, I have had a few facial procedures. I did IPL in January of last year to tackle hyperpigmentation as well as redness in my cheeks. I have also had chemical peels, and most recently I have had microneedling. And in terms of injections, I have had Botox to lift this brow to kind of even myself out and gain some symmetry. And I also had my upper lip injected to kind of give me a little bit more fullness that I've lost over time. I've always been very transparent about the things that I've had done, and one of the reasons for that is that I would like to help dismiss the stigma that's attached to having different facial procedures done. If there's something that you would like to do and you make an educated and informed decision, then I say go for it. If it will make you feel better about yourself and give you a little bit more confidence, then more power to you. And despite my handle, I am not against aging. However, if I can do things to help slow down the process and help me age a little bit more gracefully, then I am all for that. And as a nurse, I am particularly interested in the growing sector of anti-aging medicine. So the best place to start regarding pre-procedure is with consults. Where do you go? Who do you go see? And I think the best place to start is by word of mouth. Talk to family and friends who you know who may have had different procedures and see where they go and if they've been happy with the results. Another place to check out is realself.com. This is an online community where members can post pictures, ask questions, talk about various treatments, and there's actually physicians that will answer questions on there that can provide some insight and information if you're curious about different things. There's also yelp.com, and one of the things that I will caution you with is most of the information you're going to find out there is usually negative from my own experience. If you go out to a restaurant, for example, and you have a bad experience, you are more likely to get the manager to come over and tell your family and friends versus a good experience. But if you are interested in a certain professional or provider, it is a great place to go check out if you want to see what others have to say. One of my favorite places to start with trying to find a professional or provider is social media. And this is one example. This is my friend JenDermNP. She is a dermatology nurse practitioner who does both medical dermatology as well as aesthetics. And I think that a lot of folks in this particular sector are developing social media pages so that they can connect with potential clients, share their work, a little bit about their philosophy. And I think it's a great way to find a professional or provider who kind of shares your same philosophy, who you think you might connect with and can develop a long-standing relationship with. So aside from being Jen's friend, one of the things that I liked is in the before and after pictures that she posts, they tend to be a little bit more natural, more conservative, which is definitely the kind of the look that I'm after. I'm only looking to enhance what I already have and not really change things too much, and that seemed to be her philosophy as well. I'd also consider going to get consults from a variety of providers. Not everyone sees things the same way, and so it's kind of nice to get some different perspectives from various folks. And you also have to see who you connect with. Who do you develop a comfort level with? This is ultimately your face. It's an investment. Look at this as building a relationship with that individual. They'll get to know you, your skin, your goals, and ultimately they want to make you happy to where you're also going to be telling your family and friends about your experience. And I can't stress enough, beware of the deal that is too good to be true. I see this a lot on Groupon and Living Social. You could find a great Medi-Spa, for example, that has amazing providers and provides great, safe services. However, buyer beware, and remember, this is your skin, it's your face, and it's an investment. Now you figured out who you're going to go see for consults, and now it's time to prepare for your appointment. One piece of advice I have is don't wear makeup. This is going to obstruct your canvas that the provider or professional is going to be looking at. They need to see your skin in its natural state and not obstructed by any sort of makeup. And I think this is even true for injectables. I have hooded eyelids, however, I have over time figured out how to give a more lifted appearance with eyeshadow and makeup. And so if I'm going for an appointment to see about lifting my brows with Botox, for example, it's not really going to give an accurate representation of my eyes in its natural state. And also beware of being dead set on a particular procedure. You may have in mind a procedure that a friend has had and they've been happy with the results and you think their results are great. However, everyone is an individual and has individual needs, and in order to get you to the goals that you have, a professional might suggest something different that might get you there quicker with less money and make you much happier in the end. So try to keep an open mind, and also consider taking your skincare with you to the appointment, because that is something that is a critical component in the aftercare of your procedure. All right, so you've done your homework, you've prepared for your consult, and now it's time to meet the professional. One of the things that I like most is when I have an appointment, I like the professional to say, "What brings you here? What can I do for you?" Instead of, "Hey, I hear you're interested in IPL." My experience has been that skilled professionals will ask questions, they'll get up close and personal, they'll inspect your skin, they'll get to know you a little bit better before they talk about specific procedures. As you have this conversation with the provider, ask them what is realistic and in what sort of time frame. You may think that you need one treatment, but in order to get you the results that you're looking for, you may need a series of treatments, and it may take you a little bit longer than you initially anticipated. One of the best questions that you can ask is, how often do you perform this specific procedure? Now, one of the trends that I've seen in my area is that dentists are now performing Botox. While they may be trained and qualified to inject, that is not really who I want to be injecting me. I would prefer someone who is injecting day in and day out to do my injections versus someone that may do it only on occasion. So directly tied into that, you may have found a practice that you feel super comfortable with, that you feel that you can develop a relationship with over time. However, you might have the wrong provider, and I'll give you an example. I talked to a variety of people as I was preparing for this video, and many had thought that it was the physicians in a practice that do most of the procedures and injectables. However, the more research that I did, I found that nurse practitioners and physician assistants in dermatology offices, for example, were doing most of the injectables. So for me personally, I want to go see someone who performs a procedure pretty regularly, might be informed of advanced techniques, has had advanced training as well. So that is a piece of advice that I have. During your consult, ask and be expected to be told the specific risks associated with your procedure. This can include some scary things such as infection, bleeding, hypopigmentation, but ultimately you need to know the risks. You should also ask what specific things increase your risk for those complications. And I'd also find out how often that provider has seen those complications arise in his or her practice. Also plan to discuss your medical history with the provider. This can start with the medications that you take, either prescribed, over the counter, or herbal supplements. And I can't stress this enough. If a provider tells you to stop taking a medication before a given procedure, contact the provider who prescribes that medication and discuss it with him or her. By stopping the medication, it could place you at a larger health risk that you may be unaware of. Also, certain medications can thin your blood as well as cause photosensitivity, so it's important that the provider knows about those. Discuss your medical history. Certain things that you might not feel relevant might be. I'll give you an example. You may have had a history of cold sores and they may not come very often. However, if your provider knows about these, he or she may put you on antivirals for several weeks prior to your laser appointment, for example, and up to a week after to decrease the likelihood that you'll have an outbreak. Another important piece of information is, do you scar easily? Do you have a history of keloids? Depending on the procedure that you're considering, you could have an increased risk of scarring as a result. Allergies are also very important to discuss. For example, if you have an aspirin allergy, you certainly cannot have salicylic acid. If you're pregnant, breastfeeding, or plan on becoming pregnant, this is very important, as you may not be a candidate for certain procedures. And if you're immunocompromised in any way, this could also play a factor. This includes immunosuppressive therapy, chemotherapy drugs, or any sort of autoimmune condition. It's important that the provider knows about those. Next, you'll want to discuss skincare. The provider is going to ask you all about your skincare routine, and if you're like me, you'll just pull up your Instagram page. And this is important. If you're looking at a peel, for example, the provider needs to know how you respond to certain ingredients, and that will give him or her a better idea on how you would respond to the specific ingredients of the peel. If you haven't had glycolic acid before, but you're considering a glycolic acid peel that has a much higher percentage, it may put you at an increased risk for an adverse reaction. Depending on what procedure you're considering, ask what type of skincare you should be using leading up to the procedure as well as after. This includes things such as waxing as well. Some procedures will have you avoid things such as retinol beforehand, whereas other procedures are actually enhanced by preconditioning the skin. So I was talking to my good friend Hillary. She is a medical assistant and esthetician at the Laser and Skin Surgery Center of Northern California about preconditioning. Hillary said that at her practice, they're of the mindset of getting the skin in its best condition prior to the procedure. One example that she gave was introducing retinol and vitamin C at least 6 months prior to. And while hydroquinone is banned in several countries, it is still legal in the US. And she said that that can oftentimes be prescribed to patients who are at risk for hyperpigmentation at least 2 weeks before the procedure. Her and I also chatted about patients that are prone to acne breakouts, and she said that doxycycline, which is antibiotic, can oftentimes be prescribed prior to the procedure up to a few months and then even a month afterwards. You'll also want to find out when you can integrate your normal skincare routine back into your routine and talk about aftercare. Be prepared to ask for the aftercare instructions before you leave the consult, and if the provider doesn't have those readily available, I would maybe consider another consult. So to finish things up, let's talk about planning in advance. Ask specifically about downtime, not just the time that you might be at home, but when you can resume normal activities, when you're going to be less photosensitive, and look at your calendar. You're not going to want to have a laser treatment on your face a month before a wedding that you need to go to. And also consider the time of year. If you're planning a great family vacation and you're considering IPL that's going to make you more photosensitive, you're not going to be able to enjoy the experience as much because you're going to have to shield yourself more from the sun. So guys, that is it. Those are my favorite pre-procedure facial care tips. And if you are interested in hearing about my post-procedure tips, I am filming that video next, so stay tuned for that. And as always, if you enjoyed this video, consider giving me a like. I would love to hear from you. Leave me a comment below and consider subscribing so you can see more content from me. Thank you so much for all the love and support. I would love to have you back. So until then, bye.